The term autism spectrum disorder refers to three main areas of deficits, which include communication, social skills, and behavior problems of repetitive and restricted range. Each of these areas can range in severity. For example, on the severe end of the spectrum, we can have an individual that has no speech, no social interaction with others, and engages in repetitive hand flapping. Then on the mild end of the spectrum, we can have an individual who is capable of clear speech and social interaction, however, may be off topic and focused on their narrow and restricted range of interest. For example, in one of my groups, we were admiring a person's engagement and engagement ring when this individual began talking, giving a speech related to how diamonds are made out of rock. Here at Family Psychology Associates, we can provide comprehensive evaluation to identify the specific deficit areas through use of standardized interviews and standardized tests that are designed to elicit those core symptom deficits by trained professionals. To choose the best treatment option for treatment of autism disorders, professionals rely on evidence-based practices that provide information regarding time-effective and cost-effective approaches for treatment of specific symptoms of autism. Over the past decade, research has shown that behavioral interventions implemented with fidelity and consistently yields the best result in improving the symptoms. Other treatment approaches, such as various diets, occupational therapy, and medication management, although is useful in addressing physical problems and attention problems and anxiety problems that affects learning, does not address the core symptoms of autism spectrum disorders. Behavioral intervention address core symptoms of autism spectrum disorder, namely communication, social interaction, and behavior problems. They address this through identifying the specific skill deficit in each of those areas, developing interventions that are individualized for the individual with autism, then structuring the environment to make sure that the interventions can be implemented properly. Then they provide training to the individual as well as the adults responsible for supervision and care of the individual to be able to implement those interventions that addresses the deficits. And finally, they provide monitoring of the progress that is inevitable in order to be able to make changes in the interventions, maybe due to progress, changes that are maybe due to regression, changes that may be due to stage of development of the individual. There is also social skills training that you can implement to address the social deficits. Social skills include many areas of life, starting from very early stage of development with eye gaze, smile and object manipulation, and later play skills and sports skills, and advanced development in art of conversation, in initiating interaction and maintaining relationships at home and at work. Social skills is a core area of deficit for individuals with even mild symptoms of autism spectrum disorder. The training occurs through explanations, demonstrations, behavioral rehearsals, practices with peers of the same age, and it can be done within a group setting. Here at FPA, we provide social skill groups for children of all ages, including adults and young adults.